Okay, hello everyone, and thank you for joining us today. I think we're waiting for a few minutes to see if more people will be joining us. Right now, we have about 21 people. That is good. That is good. So we can start. We can start. So I would introduce myself. My name is Rachel, and I will be facilitating today's session with um, my colleague, um, Aruj.
Hi everyone, I'm Aruj, Rachel's colleague, and I will be supporting the facilitation today. Just to let you know, a heads up, it's a really, really light touch, relaxed session. Please, I hope you have got a cuppa, sit back, don't worry about taking any notes. We will share the slides with you after the session. And if you have any questions along the way, please feel free to put your hand up or pop them in the chat, and we will address them along the way. I'll just pass you back to Rachel.
Thank you, Aruj. So yes, today we will be looking at to introduce the whole area of Southwest London and talk about some of the terminologies and the structures that you would find in health and social care. We will be taking you through different roles, what they involve, and where you find them. And we would have some guest speakers who would also tell you about their jobs as well, and how they got into their roles and how they work with other roles within the organizations and across the system on a day-to-day basis. Okay. So like it says here, we'll be taking you through the different structures and terminologies you will find in health and social care, what is primary care, what is social care, and all that, and where you find jobs, the roles within these areas. Here we have two flyers that tell you about the courses that are available, free online courses for you to attend, because this program today is part of a bigger program that involves getting people into the health and social care sector. So the flyer on the flyer with the green fonts is about job readiness. It's about helping you get ready to get into roles, to work, to improve how you work in areas. And the ones with the orange one are for carers or those who work in care jobs, just to help them, improve on their skills. And you can apply for these roles, for these job courses. They are free online courses to attend. You can either do that scanning the QR code, like Aruj said, you would get the slides later, so you could scan the QR code to have access to book onto these courses, or you could go back to the page where you had seen, where you had booked onto this event for tonight, and also book using that link. All this will be available for you. And that said, I would let you know the agenda for today. So for today's agenda, we have two parts. One part I will be presenting or talking you through an overview of the landscape of Southwest London and health and social care. And then the other part we'll have guest speakers, like we said, and they would talk to you about the roles that are in the health and social care sectors from some of the organizations we have in Southwest London. But before we do that, I would hand over to my colleague, Haruj, who would want to just check with you to find out where you're from, what areas within Southwest London. And yeah, over to you, Haruj.
Thank you, Rachel. Mammon, if you could put up the Zoom poll. So just as a bit of an icebreaker to find out who we have on the session today, where you're from. Obviously, this is a Croydon session, but that doesn't mean that you have to specifically be from Croydon. So working in health and social care products. So which borough do you work in? It's a multiple choice question. So if you just let us know if you're from Croydon, Merton, Sutton, Kingston, Richmond, Wandsworth, further afield, and unsure. I don't think the looking for work was supposed to be in that one, but if you let us know. So far, we've got a 50-50 split. People from Croydon and Wandsworth. Interesting. Okay, we've got some from Sutton. Fantastic. So and it's moving, which is great. So 60% from 50% from Croydon, Sutton, Wandsworth, and someone from Kingston. That's great. Good to know. Thank you for joining today. Mammon, if we could okay, so there's a few seconds more. If anyone else hasn't chosen a answer, if they could please choose an answer so that we know where you're from. And then the second question. So have you ever considered a career in health and social care? Nice, simple one. Yes. Okay. So far, 100% have considered. Okay, maybe not. 25% no, or there's unsure. The purpose of this session is to gain that basic fundamental awareness of the health and social care landscape in Southwest London. So hopefully when we ask these questions of you towards the end of the session, we'll see if we may have changed somebody's mind. So far, 75% have considered a role in health and social care and 25% haven't. Excellent. The other two questions are for after the session. So we can't answer those ones at the moment. So there's
apologies. I think there's a technical glitch.
Okay,
we'll
no
try and
worries.
bring them back afterwards.
Okay, thank you. All right, so if I will now pass you back to Rachel. She will set the scene for health and social care. Rachel.
Yes, I will take you through that. Maman, can I take this off? Can I just close this poll? And okay, good. So great. Thank you very much, Arush and Maman. Now over to making sense of the health and social care sector. As you can see on the screen, we have three main areas in health and social care. We have the GP, which is in full term, say in full words, general practice, sometimes called primary care. And this is because this is your first point of contact when you have any health or healthcare concerns. When you move into any area in the United Kingdoms, you are advised to register with your local GP practice, which is your local general practice surgery. And these ones, they provide your first care before you go on to any other care within health and social care. And with this, you can find more roles within these areas. You could find like they comprise of your dentistry and a lot of your dentist, your optometrist, your local pharmacy. All of them are under this umbrella called primary care. And the second one is hospital, which is secondary care. And this is because this is the second point of call when you're referred from primary care for further investigation into any health concerns. And with this, you have in Southwest London, we have about 5 hospitals, and they are referred to as acute providers. And we have Croydon Hospital, we have St. George's Hospital, we have Kingston Hospital, we have Epsom and St. Helier Hospital. And these are spread across Southwest London. We also have one specialist hospital, which is called Royal Marsden, and that's in Sutton. And we have one mental health services, which is Southwest London, St. George's, and otherwise known as Springfield Hospital. And this is where you have more extensive care. We have like emergency departments, we have urgent care, elective care. I'm sure you've gotten letters from hospitals before. So that's secondary care. And the third is community care. And this is sometimes called the tertiary care or third sector. That's because it involves other organizations, voluntary organizations that come together that you find in the community. And these ones, they provide care for people within the local community so that they can live independently, preferably in their own homes. And that is why it's called community care. It has to do with helping people settle and address their care within the community without taking them into either a hospital or elsewhere. And those are the three arms or the three areas that we have in health and social care. Now, I will take you onto the landscape for Southwest London. And as you can see on the screen, we have 6 boroughs, 6 areas, local areas across Southwest London. We have Richmond, we have Kingston, we have Wandsworth, Merton, Sutton, and Croydon. And within these 6 boroughs, we have 175 practices, that's GP practices, general practice offices. And these 171, they come together to form 39 primary care networks. So primary care networks, otherwise known as PCNs, are groups of GPs that have come together to work together to provide care within their patches, within their areas. We also have 350 care homes and over 500 voluntary care social enterprises, which are like charities and community care organizations. Now, within all this, you will find that it shows you that we have loads of employers within this landscape, okay? In the past, when we say 6 boroughs within an area, and we refer to them with their geographical name, which is Southwest London. We've called them different names, you know, but right now we refer to them as a system. So when you come into a health and social care organization, you will hear things like Southwest London system, Southwest London area. What they mean are the 6 boroughs that are within these areas. And having talked about that, and it shows that we have a lot of employers, it means that these employers have different roles that are in their organizations. In the past, say for instance, 15 years ago, you would find that a GP practice, general practice surgery would probably have a couple of doctors and a nurse. But today we have a physio, we have care coordinators, and we have pharmacists, all within those practices. That goes to tell you that jobs are evolving. No 2 jobs stays the same, and you will be meeting some of our guest speakers who will talk to you about their roles, how they got into that job, what it is that they do, and loads more, and you would have the opportunity to ask questions. And that's it for the landscape of Southwest London. Right now, I'm going to hand over to Arush, who's going to take us through health and social care roles that we find.
Thank you, Rachel. So I'm going to be covering the roles in primary care. So that's your local GP practice. As being a patient myself and you to your local GP practice, you would be aware that there are doctors and nurses that you go and see. But in recent years, the landscape of the workforce is changing. It's adapting and it's evolving. And as you can see from the diagram in front, apologies for the font being slightly small. Again, remember, we'll send this over to you after the session. We've now got these 17 diverse roles that have come into play in primary care. Now, as my colleague Rachel said to you, a PCN, a primary care network, so a cluster of GP practices that work together for the population health of that specific area. They are given a pot of money to enhance and expand their general practice workforce. They're given that pot of money by an organisation called NHSE, which is NHS England, and it's to diversify that workforce, but also to fulfill the demand in primary care. So, for example, if a patient comes in to see a medical professional, but they don't need a prescription, they don't need medicine, then perhaps they should see a social prescriber and not the GP. So it's just to give you a snapshot of the fact that there are so many roles. 2 of these particular roles, a social prescriber and a care coordinator, will be on the call later on, and you will speak about how they got into, you will hear about how they got into their roles. But basically, the allocation that these GP practices have to choose from these roles is dependent on what is most useful to their patients. So if an area has a lot of housebound patients, then they might prefer to have a paramedic who can do home visits. This all started off back in 2019, which feels like such a long time ago. At that point, they had to have a pharmacist and a social prescriber on site in their GP practice. And in 2021, it also included a physician's associate, a physio, and a paramedic. So it's, again, just to let you know that there are so many roles available. There's lots of intermediary roles, and not all of them have a prerequisite in terms of a medical qualification. And that's the purpose of today. I'm now going to pass you over to my colleague Ali from Skills for Care, and she will tell you a bit more about social care. Thank you, Ali.
Hello. I've been sort of asked today to come in and talk to you at a bit of short notice, so I don't know who's controlling the PowerPoint. Oh, marvelous, excellent. I shall put my thumb up when I want it next done. Now, some people I can see, some people I can't. So I may pick on a couple of people to see if you know any of the answers to these questions, because I am representing social care. Lovely to see some cameras coming on. This means that I've got volunteers. Excellent. What I would like you to do is thumbs up or thumbs down. Can you show me your thumbs up? Just show me your thumbs, guys. Are you there? Thumbs up. Excellent. I've got an Anita and a Lynn. Marvelous. Right. You've got to give me a thumbs up or a thumbs down if you think the question is right and if you think the question is wrong. Okay? So the NHS employs more people compared to adult social care in the UK. So who do you think employs more? Is it the NHS or is it what my colleague said earlier, community-based cares? So that's your care homes, your or you don't think that the NHS? Oh, Anita, you've committed. No, you're absolutely right. If you press the first button on the PowerPoint, you will see that something will happen. There we go. No, there are my stats. It's really important to realize that most care happens in the community. It happens where we get sick, not in the hospital. How often have you been poorly or needed support and you've never gone to a hospital, but there's been something locally? So the next question is, the annual budget for adult social care is about the same as the NHS. Oh, the answers come up beforehand. No, it's not. Good. Excellent, Anita. Let's have a little look at this answer. So in actual fact, NHS, could you put up the answer for me, please? The NHS receives a huge amount of money compared to social care. Now, if you think social care is happening every single day to most of us at all times, to think the disparity is so high is really quite worrying. We go on to the next piece. Are all adult care funded by the local authority? Is all adult care funded by local authority? Andrea, I can see you looking at me. No, it isn't, Anita. That's right. And if we have the answer come up, it isn't. An awful lot of it is self-funded. And when you look at that, I'm looking at some very shocked faces here. Most care in the community is self-funded. So there are around 6,000 independent adult social care providers in the southwest of London area. Would you agree or disagree? Agree? We actually have an awful lot of social care providers and they're changing constantly. Every day I speak to new providers, so they're constantly coming along. So what we're looking at now is a service which provides for absolutely everybody, doesn't receive an awful lot of funding, but is very prevalent in our community. So over a third of adult social care providers employ between 1 and 4 people. Yes or no? What do we think? Adult social care providers are domiciliary care providers, are people working in the communities. What do we think? Should we have an answer? You're all looking very confused. Most companies providing care are quite small. They're people who live next door to you. Many of you see the cars or the transport sitting outside neighborhood environments. Companies are small, they're personalized, and we'll come back to that word in a minute. So most adult social care employers are employed by the local authority. What do you reckon? You think so? Anita, no? Oh, Andrea, you've got some inside information. And the answer is I can tell you the answer, no, it's not. Very few people are provided by the local. I like that, Anita, very good. But we have most people employed privately. And this is a really interesting space for us to be able to find work in. So if we go to the next piece, the next question is, if not all adult providers are regulated by the Care Quality Commission. CQC, you may have heard of it. It's the Care Quality Commission. It's at the Ofsted for Care. Do you think many people are monitored and observed by and overviewed by an external organisation? Oh, Andrea, she's making a full commitment there. Yes, we do have an awful lot of providers who are monitored by CQC. And this includes people who are providing care for the elderly in their own homes. Any time that you touch somebody and you provide care on what we call personal care, that's when we need to be registered. So we can help somebody from a distance, that's fine. But the minute we get involved with somebody personally, we've got to be registered. I get the distinct impression that Andrea is in Hamilton, is maybe working in care already, because she seems to have that look in her eye. So next one, less than 10% of people receive direct payments to fund their care, i.e. people who fund their care by receiving money that they manage themselves. Do you think people are managing their own money to buy the care they want? Oh, I've been a spotlight. No, they don't. Okay, let's get the answer up. No, people with direct payments actually are quite low. And we encourage people to control their own money. It's your care. Control your own money if you can, if you've got that ability and that support system. And that certainly, I think, is going to be the way we move as we move forward in society. So moving along, we've got the principles of care. So I do apologize if I sometimes seem a little blocked, but you've got to bear in mind, this is not my presentation and I'm playing catch up. So the principles of care are really important. We all want to live at home. Well, I hope most of us want to live at home as opposed to anywhere else. Nice hotel would be good, but we want to live in our own homes. When we're feeling vulnerable and we want support, we want people to come to us and help us. We all remember the soup from mum and when we were feeling poorly. It's the same when you, any time of your life, you want to be the place you feel most comfortable. So that's what we always try and do with social care. That wonderfully, beautifully funded NHS, we're trying to do it on a lot lower budget. And the purpose of care is to provide personal and practical support to people that we help. And people want simple things. Now, there's a picture here on this particular piece, which shows a dog. Now, how many people have pets? Yeah, some of you may have pets. Thank you, Andrea. I love the hands up. It makes me feel very involved. I have a pet and I hurt my knee this week. My husband's had to walk the dog. It's a practical form of support. And I think that's really important when we think about working in social care is what are we doing to help people? We're making them feel safe and secure and able to deal with the road of recovery. So what we want to do is help people for independence. And that means sometimes that we go into somebody's house and we support them to fully get dressed on one day. The next day, they may be the ones that pulls the t-shirt over their heads. And these are all steps of independence, giving people the choice and the control over their lives. Oh, somebody got excited there. So there is a common perception of social care, and that's around those resources. It's very much around what happens in care. And unfortunately, the first thing when I say care to you is you think about doctors. You think about people who are going to be offering what we call a clinical response. But that's not the case. Resources are in the community to reduce the pressure on the NHS. So everybody who works in the community can help that wonderful NHS that we all love to be able to do the job they're doing, which is the point of urgent care. And what we can do is in social care is look at some of the bits that need community responses. Very simple things. By supporting somebody to drink a sufficient amount of water on a hot day can stop them having a kidney infection and ending up in the hospital. But there's an awful lot goes on outside of the NHS. And I want you to think about your lives and how frequently you've got support in your social care that hasn't involved a clinician. So if we go on to the next one. We talked a little bit about how it was structured, and earlier my colleague was talking to you about the NHS and how we have primary care. And that's very much around your GPs and the work that they do to support your health needs. But health is a very broad thing. And as I've alluded to, health is about supporting somebody to be healthy and to be the best person they can. And to do that, social care is broken into two very clear areas. We've got the local authority funding, and they provide home care, day services, personal assistance, and shared lives, nursing homes, care homes. They fund all those areas. And then we've got the self-funders. And they too fund those areas by paying for their own care. And that's very much done around a system of means. People check to see how much money somebody is holding, and depending on the amount of money will depend on how their care is funded. Very different from the NHS, which is free at the point of delivery. So we deal with not only people who are needing support, but also people who have to be treated as customers. And that takes us very much onto the agenda of personalisation. And all those things that you can see under central government and local systems, they're talking about personalised systems that reflect your needs. If I went into a care home, I'd want a care home that reflects my needs. If I want to have a personal assistant, I want somebody who likes dogs, because as I mentioned, I have a dog. So a lot of what we do within care, in social care, is about that individual, putting them at the center of the journey of care and well-being. So if we move on to the next slide, very quickly, we'll look at this. We've got local authority funding. And if you press the button again, you will see that 85% of local funding is now being done as critical and substantially needed. So as we know, the local authorities are really struggling with finances, and they only have a legal obligation to provide critical support. And the law is very different from what is actually delivered. Our local authorities are working very, very hard at the moment to deliver the services that they have going on. However, as you may have seen in some of the newspapers, 80% of the councils and local authorities aren't going to be able to meet their budgets in the way that they want to. So we are moving into an environment that's very different. And it means that whoever comes into the field, they are really having to be creative. And it's a lovely time to be dealing with these situations, because what we're actually doing is bringing families, full care packages together. So it's not just the paid employers, families are becoming highly involved. Clinical care comes together, and we work as a group to support the best outcomes for people. But it's very important to recognise that we are challenged in our finances, and the local authorities are struggling. So if we move on a little bit, I want to talk about the value of social care. If you could click on. Why do we have social care? Well, social care is there for a variety of different reasons. It's there to prevent people having to go into hospital, because we can provide for their needs within the community of care, in their own community. So we're going to have less admissions into the hospitals, which allows the hospitals to function. And we know since COVID, that's been a really challenging time for them. We're able to really plan discharges as well if we work carefully with social care. Now, what happens when somebody comes out of hospital is they need to go somewhere safe to do the next stage of their recovery. And with a good structured social care, we work hand in hand with the NHS to support people either to go into their own homes and be supported by domiciliary care, or we work with people to go into care homes and be supported in the right environments with people who have the skills that they might need in that environment. By working closely with every part of the community, social care aims to bring all the parts of somebody's life together at the right time and the right point to offer the right support that they need. And that does come down to us knowing the individual, knowing our environments, and knowing that the people we work with share our values. And our values are so important. I've worked in care for 40 odd years. I started off knowing nothing. What I learned from my colleagues at that time was the values of care. The fact that in many ways, I didn't need to know all the technical bits. What I needed to know was the individual was the most important person in the room. And I needed to know that whatever they wanted, my job was to try and facilitate that. From then on, I hope I gained 40 years experience, but who knows? So let's have a look at language a minute. As we move on, if I could go to the next one, I'm very conscious that time is more important and the people who've had lived experience are far more interesting than I am. But I want you very quickly to have a look at this language. Are there any languages there that you would particularly find difficult to hear? Are there any words in that particular presentation, in these words that you wouldn't feel comfortable with? And I'm going to make it easier for you. In social care, we don't use the word patient. We may use service user. We may use the person who uses the service. We may use somebody's name, which is really wonderful to do. So I don't like the word patience in that. I certainly don't like impatient either. I really don't like impatient because nobody working when dealing with somebody who's vulnerable should be impatient. If you are, take 2 seconds away, deep breath, walk back in the room. I don't like the idea of the word bed blocking because that assumes that somebody is doing something wrong. The reason why people get stuck in the NHS system and they get caught in the beds in the wards is because our systems haven't worked as effectively as we would want, or they can't find the support they need. So we work really hard to ensure that we don't have bed blocking. And finally, I don't like mental health problem. What's a problem? We've all got mental health. I've got good mental health some days. I've got bad mental health some days. It's never a problem. It's just a different day. So if we move very quickly on, because I've only got about a minute or so more to talk to you, I want to say to you, we've got some great jobs in care. We've got some amazing jobs in care. 1.6 million jobs in care. You don't have to have experience, you have to have the right values. We can teach you the skills you need. And there are many employers out there who will help somebody develop a career in this field. And I would say it's one of the greatest jobs in the world because every day you go home knowing you've made a difference to somebody. So when we look at those figures, think about the professionalism. Thanks. There's some great different roles. And this is the final piece I'm going to do. As we move through this, we started off with just people understanding the words care and support worker. Social workers were known. Some people know nurses and registered workers. And as we move forward, then you don't always think about all the administrators that are there, the occupational therapists, the volunteers. And more importantly, we've got all those other people that make those days go well. The housing officers, the drivers, the repairs, the maintenance, the chefs. If you've got any interest, there'll be a job in social care for you. Have a consideration. If you want to talk further about any of these roles, do come to talk to me, and we have lots of opportunities available. To care for those who cared for us is one of life's highest honors. And I believe that was my 15 minutes of fame. Thank you so much. Thank you so much for actually listening to me. I hope it's been of interest. I love working in this field, and I hope you find a job that suits you and that you can help people in the best way possible.
Thank you very much, Ali. Your passion for social care shone through and through. Almost made me want to,
come on over. Call me tomorrow. I'll have a job for you by the weekend. Honestly, we'd love to have you.
Great, great, great. So yeah, the floor is open to everyone.
Indeed.
If you've heard from Ali, I'm sure you have that interest. Please, buzz her, contact her, and she'll show you the way.
Bother me. I am, however, going to have to leave now, Rachel.
Thank you very much.
I did step in at a late minute, so I hope it goes well. If you need any contact details, please get in touch with me.
We will.
Thank you
very much. Have a lovely evening.
And you guys.
Now over to Aruj to talk to us about the roles that, we'll be discussing in more detail later on. So over to you.
Thank you, Rachel. So as we've heard from the lovely Ali there are so many roles in social care and all those roles in primary care and GP practices. So for the purpose of this particular session, we've brought it down to 2 roles in primary care, the social prescriber and the care coordinator, and 2 roles in social care, the administrator and the support worker. Now we have a speaker from each of these roles that is going to talk you through their entry routes into their role and what they do, what it entails, the kind of training they got on the job, and what they feel about it. Just to let you know, obviously, like it says on the screen, a social prescriber is also known as a link worker, a community connector. They work with so many different organizations, the voluntary sector, community and wellbeing, They look after and support mental health needs, long-term conditions, complex social needs. So they're the go-between, the connector of the community. Care coordinators also work with community services, secondary care, mental health teams. They are the provision of information. So they are the ones that collect the information and join the information. They look after patients in terms of those with multiple appointments, frail and elderly, and look after the care planning of patients. Now, an administrator or a receptionist is what we know in terms of any role. They'll work with residents, say, for example, in care homes, visitors, care support teams, the community, all sorts. They're the front door. They will support communication, internal systems, administrative duties, and problem solving. They're there to do everything, the one-stop shop, and we have a lovely speaker to represent that role. And then we have the support worker. They connect with the clients, the caregivers, community, social services, primary care, secondary care, basically everyone you know. They support the provision of care. So it's all about the physical and emotional support that their client needs. It's about skills development. It's about getting them into the community and engaging with the community. So they're the 4 particular roles that we will be focusing on this evening. But if I can move on to the next slide, please, Rachel. Thank you. So what we've done today is we've told you a bit about primary care. We've told you a little bit about social care, and we've told you about the roles. But then I hear you say, well, where do I find these roles? Where am I going to look? So what we've done is we've put together a number of links here, which will, again, like I said to you at the beginning of the session, we'll be sending them to you so you can look at them at leisure. And what do they include? So they include local authority. That could be a good place to look for social care jobs. NHS-specific job websites, some more difficult than others, I have to admit. Recruitment sites, Indeed, WorkMatch, local, recruitment agencies. Then there's community providers, people, organizations that sit within the community for roles in the community, such as SWL and Enable. And then there's generic platforms like LinkedIn, if you have a profile on LinkedIn or Glassdoors. So just to give you kind of resources so that you can access them after the session. And if I home in on one specific one, there's Skills for Care right in the middle there. And that's where Alison was from. And it's worth looking at that, if not any other. If I could ask you for the next slide, please, Rachel. Thank you. So I'll move on to volunteering. Now, we wanted to highlight volunteering as a route to work experience. Now, volunteering is not only a noble cause, so it gives you that feeling that, something that you've given back, but it's also a valuable pathway into gaining work experience. It could give you a taster for a future job or an industry. And so what we think is there's numerous benefits for volunteering. You can develop your skills, you can demonstrate commitment, there's flexibility, and that taster session. So if you like it, great, not, then doesn't matter. So what we've done here is we have made sure that you have links to all the volunteer centres per borough across Southwest London. So you've got your local one, but then you've got others as well. And other than that, we've got kind of more generalized ones specific to health and social care, so NHS specific ones, but other just volunteering opportunities as well. So having said that, it's a nice segue into my next speaker. We've got Emma on the call today to represent the voluntary and community sector and how they fit in with health and social care, should we say. So Emma, over to you.
Thanks very much, Ruud. I was going to say that Annie's going to be such a difficult act to follow, so I'm glad you went after her. But I'm going to try and convince people why the voluntary sector is such a good route for this kind of work and how we connect with social care, health and social care. So I'm Emma Meir. I'm the CEO of the Asian Resource Centre of Croydon, and so pleased to be here tonight because I think it's such an incredible way of gaining experience in health and social care and doing something beneficial for the community at the same time. So you spoke about volunteering. I'm going to talk a little bit more about some of the actual roles that we have in the voluntary sector that are paid roles, and you could potentially make a career in the voluntary sector doing this. So the Asian Resource Centre of Croydon is a voluntary sector organisation. We're what they call an infrastructure charity. So we are representative of a group, a community, and in this instance, it's the Asian community and the wider BME community. We've been around in the borough for over 2 decades, and we are really about championing the work of health and well-being. It's about dealing with issues that are community-based and trying to improve people's lives. I'm going to try and go through as much as I can very quickly because I want to really tell you about the roles that are available. In terms of our projects, we do things like we run health and well-being projects, we run cancer awareness projects, things in mental health. We do lots of research projects and help the university hospital, for example, with their equality, diversity, inclusion projects. We're doing a project in maternal care as well. We run what they call the community hubs. Or we're in partnership with another infrastructure organisation running the community hubs, where we have lots of different providers come under one roof to support communities to go in and get advice and signposting to services then and there under one roof. We've got a food club, which is a food bank essentially, and lots of other things you can see on that list that I won't go through all of them. But we also do things like community health checks. So you'll find us pop up in different events and different places in the borough, taking BMI, blood pressure, giving advice on diabetes and other things. So if we move on, so the voluntary and community sector is absolutely thriving in Croydon, and there are thousands of voluntary sector organisations, and we can really help health and social care to care for people within the community. We reflect basically the rich cultural and ethnic and socio-economic diversity within the borough. Our organisations collaborate with many different sectors. So we work with the private sector and we work with the public sector, the council, the NHS, to deliver many services and make a real impact around prevention and actual delivery. The voluntary sector is characterized by innovation and creativity. There's so much going on in our work. And some of the things that you might see voluntary sector organizations do is work around health and well-being, around education and youth development. You might see us do stuff around social inclusion and integration and around environmental sustainability. So in terms of the employment opportunities that we've got, so if you, for example, worked for my organization, you might find yourself being a health researcher, a project manager, an IT person, an admin person, or a marketing and communications person. You might find yourself actually going to care homes and connecting residents to the outside world and services. You might find us as mental health workers or doing a bit of work around counselling or Core 20 connectors, which is looking at health inequalities. We also have lots of volunteering opportunities if you want to help us out at the food club, become a community champion or a health champion, or simply become a project advisory group member where you can help us to co-develop our projects. In terms of the health and care connection, what do we do? Well, health charities play a crucial role. And I think I kind of mentioned that before, but we can help in things like service provision. We can help in advocating and campaigning on particular issues. We do lots of research and innovation. We do training and education, and we do lots and lots of community engagement and support. And during the COVID, we proved that the third sector, as we're quite often known as, actually became very much the first sector when it came to emergency response and relief and helping people through the pandemic. We do all of this by partnership collaborations. We collaborate and work in partnership with many different sectors, with many different organizations to make sure we can make a proper community impact.
Thank you.
I'll leave it there.
Thank you so much. Thank you. I do agree with you when you said, the first sector, because you guys have grown from just like a social community to like a full-on organization with all those roles in there. So please, everyone who's in this session today, please have a look at their community and see where you could chip in, Now so thank you very much, Imam. Thank you. Now over to the second part of our session today, where we're going to be talking to our special speakers, our guest speakers, who would tell us about, the roles that they do and what it is. And our first is Linda Graham, who's a social prescriber. Over to you. Is Linda on screen, Linda?
Can you hear me?
Yes, we can.
Perfect. Good evening, everybody. My name is Linda Graham. There's two names to my role, a social prescribing link worker. So we have renamed ourselves. We are wellbeing link workers, and I've been working for the NHS since 2019. Let me explain how I got into the role. I still am an exercise specialist, so I help people get moving for the benefits of life to keep them strong. And I have always engaged with other human beings on a really trustworthy level. So building relationships with other people and gaining their trust and empathizing with people was my skill into this job. So that was my entry. I used to work in local gyms and for hospitals. And then this position in 2019 became available, and it interested me so much because of how I feel about our beautiful NHS. Let me explain what I do within the role. I work in 5 surgeries within my primary care network over here in wonderful Croydon. I engage with people that need social support, not clinical support, which our GPs are doing and our clinical teams. My role is to sit with a person half an hour and ask, how are you? And the conversation of how are you opens up a very wide agenda of conversation and care. Once I get the most important things that matters to a person, for example, they may have asthma and they may be in terrible accommodation. And so therefore we need to try and support the housing situation if we can. Again, we can't promise on that situation, but we try and go through avenues of support for a person. So it's really about, how are you? What do you need? And how can I help? Now, our GPs don't have that time, that luxury of time. And so this role was initially brought in to save GPs and clinical technicians time, because that's our unique selling point. We have that time to speak to people about what really is underlying affecting health. A lot of conversations around lifestyle, how to manage health conditions, and working with trustworthy organisations that we collaborate with within our locality. So if I go into how does it link with general practice? Okay, so I am inside the surgery walls, inside the GP practices, but actually my role is to bring community into primary care. So to try and bridge that gap between what's out there, bring it in and explain to our clinical members, our colleagues, what's going on, what's available, and what's on our doorstep. Explaining to the patient waiting list, conversations around their care, explaining their care. I like to do this over a very relaxed, informal way of having a cup of tea and a very informal conversation. We can do home visits, we can do walks in the park, we can sit on a park bench. We can open up those conversations in a very different way. So as it says in the next slide, the USP for patients, people, GPs is the time. We have 30 minutes per appointment with somebody. The most important thing to me is what really matters to you. What do you need right now to help you move forward? And it's very much linking into social care. What really matters. It could be that they need their dog walking or they need their garden tended to while they're in hospital, all of these things. Collaboration is very important, invaluable for people living with complex health needs, and giving them that information and signposting, so telling them there is support, it is out there, and we're going to help get that for you. Patients are supported by the link worker, myself, sounds a bit formal. To be honest, the time frame is not passed in a 12-week period. I've been supporting people in and out of their NHS care for nearly 4 years, and that means it could be one appointment every 3 months of how are you, so they still feel connected. I want to try and engage them with their surgery. I want to get them involved in what's going on in their surgery. I want to explain to them the processes. For example, the new NHS app, which can be quite confusing for some people. We bring people into the digital world, and we offer workshops around digital support. So it's about just listening. What do you need? How can we help get what you need? I have a very nice case study. We had a gentleman back in December with a cancer diagnosis. His doctor noted that he wasn't eating properly. He was losing a lot of weight. Further to a very relaxed conversation, we found out the reason he wasn't eating is because he didn't have cooking facilities, no sink and no heating. So the cancer journey and the treatment journey was not supported by his existence of living. So we liaised with the council housing team, Macmillan Care, British Red Cross, the link worker, and we got him moved. And so therefore now he attends weekly community groups. He is a wealth of information. He is a quiz master, and he delivers information for my local group. I have a wonderful elders community group that I've also established over the last 5 years. And it's about bringing people's gifts and talents back to their existence, even though they have a health condition. I think there might be another slide.
I think that is your last slide, but you went through it quite fast, and thank you very much. It shows you're a people person. A simple "how are you," and just opens the floodgate, and you're able to have resolved Mr. D's issue, and now he's a quiz master. Fantastic. Yeah. Good. Thank you very much for that. Next we have Hamid Ibrahim, who's a care coordinator. Hamid, are you online? Would you like to step up to?
Hi, hello. Is everyone able to hear me?
Yes, we can.
Hi there. My name is Hamdi. I'm one of the care coordinators. Don't worry, my name is mistaken all the time. But I'm one of the care coordinators, and I work in the Thornton Heath area. Would you like to go to the next slide? Okay, I thought there was another slide beforehand, but yes, my name is Hamdi. I'm one of the care coordinators in the Thornton Heath area, and I'll just start off by saying what is a care coordinator. So a care coordinator really just helps to coordinate and navigate care across the health system. So we help people, or we help our patients to find out what services are available, because we notice a lot of the time patients, they don't know the entirety of the services that we do have available, connecting them to the right teams, and just acting like a point of contact for patients, and being able to refer them to people like Linda, the social prescribers, people like mental health practitioners, and giving them the support, and as well as time. Linda pointed out, GPs and other clinicians, they don't necessarily have the time to spend and speak with patients, and so part of our role is to give them that extra time and that listening ear to help them to be able to realize what they need, and also identifying reasons such as why they aren't particularly engaging with their health needs, or you might find that a patient hasn't been attending their smears for many years, and identifying what the reason might be. And so with a particular patient, she wasn't attending because she was very nervous. She's never had it before, and she was scared. And so for me, I was able to then advise, direct her towards an out of hours service where she could have a specialist smear appointment dedicated for people who were nervous and, you know, a bit more apprehensive. So, you know, those services are not necessarily commonly known. And so our job is to link those services to the patients. And so this is, you know, a handy little diagram to show how we can kind of, you know, how we kind of link with other staff members. And so my particular role on this end sort of shows you how I can, you know, I kind of link mainly to like the health and well-being coach here, but not necessarily. I can also, you know, direct people to social prescribers, and, you know, it just kind of shows you all these roles, they do link together. You know, it's not really an isolated role, and we do work together to just, you know, coordinate care. In terms of training that I have undertaken, I think the most important point to make here is all the training that I did, it was done during my role, within my role as a care coordinator. I hadn't necessarily done any extra training outside of my role. And, you know, things like personalized care, health and well-being training, coaching, various screening things that we've training that we've done, that was all done during the role. And actually, when I started as a care coordinator, I started as a student. I was a student in university, so I hadn't, you know, achieved a degree or anything like that. And so this just goes to show it is an entry-level job, something, you know, that is open to anyone, and anyone can do, really. A day in the life of a care coordinator. So my time generally varies. More often than not, we are speaking to patients. At the moment, I work 3 days. I'm a part-time worker. I used to do full-time, but after maternity leave, I reduced my hours. And so at the moment, I am working across those 6 different GPs over 3 days. And so I, you know, check any tasks that may have been given to me from other staff members. I conduct searches, identify particular target patients that, you know, may need screenings, immunizations, and other services. And, you know, we speak to a lot of patients. But what do I enjoy mostly about my role is, you know, being able to give the extra time and attention to patients, making them feel like, yeah, we are listening, we are here for you, and just making a difference on people's health journeys, and, you know, allowing them to have that sort of like informed decision making, and giving them more information about what's available to them. And just, you know, making a difference to people who won't, to patients who might be underrepresented in our communities. And for me at the moment, it is a flexible role, and it works really well around families. So I think that's another great point.
Thank you, Hamid. Thank you. I got your name right now. Thank you very much. Thank you. Your diagram about the link, about, you know, showing how your role works with the link work and the well-being coach is just fantastic. It shows the flexibility with which we interact with one another on a day-to-day basis. So thank you very much. Thank you. The next person is Andrea. Andrea is an administrator, a care home manager. Andrea, are you here with us? And please, if you have any questions, please either pop them in the chat or raise your hand. I can see the chat and the, I think the screen to a certain extent, but Rouge is monitoring as well, so we can pick your questions. Are you here, Andrea?
Yeah, I'm here. Can you hear me?
We can hear you. Thank you very much. Over to you.
Hi, everyone. My name's Andrea Day. I am the home manager now of Hamilton Nursing Home in the Borough of Kingston. I started life off as an administrator, so I'm going to talk to you about my role and how it's developed. I am certainly not a presenter. You definitely don't need presenting skills to work in admin. So please don't let that worry you. I absolutely had no interest in health and social care. I can honestly say I worked for Walls Ice Cream in a marketing job that was very random, weekends, being in a leisure background. I had my first child and I needed to look for a better work-life balance, something that gave me a bit of a 9-to-5, but initially part-time. And when a nursing home was mentioned, I ran, because I just thought I'm not going to work in a nursing home. It's not for me. How wrong could I be? 22 years later, I am still here. I think I had a bit of office work background is all I would say, and I just sort of developed on that. So I came for the interview. It was a family friend that suggested it. The best thing that I could have ever done. The role is really about the personality, I think, within as the administrator. Your hands are in so many pies. You're looking after and helping, supporting so many different team players. So yes, you need to have a little bit of grounding about you. So you need to have a telephone manner. You need to be able to talk to people. You need to be compassionate and kind, and a personality definitely over experience. When I came in, and I'm talking about this is 22 years ago, so I asked for this training. Now, because of CQC, and Ali talked about CQC, we have a lot of training units you have to do, which are mandatory. But with regards to building up my admin skills, I asked for a customer service course that really gave me lots of information about how I can support the customer. From someone walking in the door that's looking for a care home, that's never been step foot in a nursing home, is a really scary experience, and often the administrator or the receptionist is the first person they see. So a welcoming smile, a comforting arm is really important. So that's why I think your personality can supersede any of your experience that you may have. I asked for diversity and equality training for all of my staff. This is an extended home to all of our residents, and when you live in your own home under one roof, you all generally have similar traditions, cultures, backgrounds, lifestyle that you choose together. And when you're in a nursing home, it is an extension of your family. So I like all my staff to understand different traditions and cultures and how we work together. That also applies to not just your peers and your colleagues you're working with, professionals coming through the door, and most importantly, the residents that you're looking after. Diary and time management, again, it's very hard to plan a day because we work with our residents, and residents can have good days and bad days, and sometimes some things can change. You have to have, be prepared for your day to be quite fluid and move. And there are some things you need to be quite strict with regards to reporting. So you need to try and manage it. So you need to be fairly organised and be able to manage your time effectively along with your manager. And payroll, my administrators and I was asked to support payroll, so sort of capturing hours worked for all of the staff in all departments. So you actually became everyone's friend because you were making sure they were paid on time. Organisation is key. As I say, you need to have a level head, you need to be friendly, and you need to manage your time. The rest just falls into place. It's so varied, from answering the phone to reporting. You don't need to have lots of experience, as long as you can reply to emails, as long as you can open a Word document and maybe have looked at an Excel spreadsheet. All of that follows. There's no one main thing that stands out. The day is very, very different. From maybe saying I'm going to take a resident for a walk, I'm coming out of the office because I want to get involved with the resident to know more about their life. You may be asked to attend a meeting to take minutes for a disciplinary if we're working with HR, and you may be just chatting to paramedics that come through the door. So it's very, very varied. No day is ever the same, and that's what I think I loved about the role. I transitioned then from administrator into deputy manager and now home manager, and I think the whole picture, no department is more important than the other. The administrator helps the wheel turn, and without the administrator, we sort of cease. We have a puncture because you're involved in everywhere. So it's a really important role. It's a fun role. It helps you give the care to residents. You don't have to have a nursing background, and it really gave me the grounding and the love of working in this sector, and I would never ever be without it. My only regret ever is that I didn't join here sooner, and listen to my mum, who said, I think you should be a nurse. And I said, absolutely no way. And that's my only regret. I love the environment. I love the fact that you make a difference, and you can make a difference in any role within the health and social care sector.
Yes, yes, yes. Thank you, Andre. You have nailed it, being calm, being organized. And I think, yeah, Linda was just saying in the chat that being organized is one of, the skills that applies to link work. And I think the same for a care coordinator. So you see the similarities with the 3 roles that we've had so far, the skills that are required. So yeah, thank you very much, Andrea. Thank you for giving us your time today to walk us through your role. Next on our special guest list is Dawn. And Dawn is a support worker. Dawn, are you around to share your experience, your work? Are you in the house?
Dawn, you're still on mute.
Oh.
You need to unmute yourself.
No one I couldn't see her. We all fall into that trap before, don't worry, Dawn.
So I'm a support worker with an organisation called Special People, which provides services for people with disabilities. I would say the scope of the support worker role is very wide. I am mostly providing support to children or young adults with additional needs, either in their own homes, can be in health and social care settings, or out in the community. Can be providing physical support with things around the home and mobility, obviously depending on the client's needs, what their particular support needs are. How I got into the role, I'm actually a qualified solicitor. I used to specialise in court cases about children. I stopped working as a solicitor 11 years ago when my daughter was very young, because I wanted to spend more time at home with her. When the time came for me to return to work, I didn't want to go back into the law. I wanted something challenging and interesting, but less stressful and more flexible, something that I could do part-time, and work around my daughter's needs. In my previous work, I particularly enjoyed working with vulnerable clients with a diverse range of needs. I'd become skilled at working with people with mental health conditions, substance addiction, learning difficulties, physical disabilities. And I knew that I enjoyed providing a service to people who needed help and advice. And I'd enjoyed building a rapport and a relationship of trust with those people. And those were transferable skills for the support worker role. On a few occasions, my clients had actually come in to me with the help of a support worker who might have made contact with me on their behalf and arranged the first appointment and then attended the appointment with them. And I can actually remember looking at the support worker and thinking, I rather fancy your job, because I like the hands-on nature of the support worker role. And I like the idea of giving support that was immediate and practical. I already had some practical experience of caring for an autistic child, a friend's daughter. She's now 17, but at one stage she used to be around at my house every week. We had sleepovers, days out and such like. So I had that life experience to bring to the support worker role as well. Once I decided I wanted to be a support worker, I did some volunteering in the health and social care sector to get some kind of recent relevant experience and an up-to-date reference before applying for a support worker job. I did some volunteering actually for St Joseph's Hospice, and also I live in Hackney, so the Hackney Volunteer Centre. I volunteered as a community befriender, and used to visit the service user, who was a lovely lady who'd been diagnosed with bipolar disorder. And I used to just spend time with her in her home, or accompany her on like trips to the local cafe, or take her shopping. So that was the volunteering that I'd done to get experience for the role. I was put in touch with Special People originally about a volunteer placement with them. But then when I met Alison from Special People, she told me I might as well be paid for the work. So I put in a formal application, did a formal interview, and got the job. Enthusiasm, I would say, is something you definitely need for the support worker role. It's a job where you get back what you put in. And I would say if you're interested in people and you want a job you can feel proud of, the support worker role is incredibly rewarding. My approach to the role is I aim to be the best support worker that I can possibly be. And that makes me feel good about myself and good about my work. On to training and support. So when I started with Special People, I was given an induction training session at the office. The company require all their support workers to pass the care certificate within 3 months of joining. They fund the training and it's all done online. I actually completed mine in a week because I had time on my hands before starting my first assignment, and I wanted to feel that I knew everything that I needed to know before I actually started on that first assignment. We also have in-house training. I've done some manual handling training, and I'm due to have some practical training in first aid and epilepsy in a couple of weeks. There are also opportunities to train on the job. Some of our clients need 2 support workers together. So if you don't have the right experience or training to support that particular client, you can team up with another support worker who does have the right experience and training, and then you can learn on the job. Every 6 months, I have a formal supervision session where I can discuss any difficulties I might be experiencing, particular things I'm enjoying about the job, and any particular training needs, because the company's interested in each support worker as an individual, and if there's something I'm especially interested in and I want training on that, then they will certainly look into arranging and funding that for me. And also in terms of support, there's always the team at the office are on the end of the phone during normal working hours, and one team member is also always available 24/7, basically out of hours, because some of our work can involve staying with clients overnight, that sort of thing. So there is always someone available on the end of the phone if the support worker needs it. A day in the life. Well, I'm currently working with a 5-year-old boy who's in a short-term foster placement, and he has an autistic spectrum condition. So I link in with the foster carer. I would arrive with a basic idea of what that day's assignment is. Is it getting him to school? Are we doing a community activity? Am I taking him to an appointment? When I arrive, first thing I need to do is assess his needs and work out what his support needs are today, because it can be very different. Sometimes I'll arrive, he's dressed and ready for school and willing to go. Other mornings I'll arrive, he's still in his pajamas and he's hiding under the bed and doesn't want to speak to anyone. So, my day can start very differently depending on how he's feeling. Then I've said you always need to be ready to be flexible and inventive, because it can be so different. I mean, for him, I always think, how can I make his day fun and enjoyable, or whatever it is that we need to get done, particularly if he doesn't really want to do it, like quite often doesn't really want to go to school. How can I turn that into a fun experience? I then have a long break in the middle of the day. I actually go home for a couple of hours and let the dog out. And then I go back to collect my client from school. He only does mornings, and then I might be taking him to the park, or taking him to contact centre to have supervised contact with his mum. And sometimes I have supervised those contact sessions myself. At the end of the day, I have to write a handover note. And then I always like to reflect really on how the day's gone and think about what I could have done better. Or what did I do particularly well that day? And then linking with the team, I actually forgot to put on my slide that we use a Care Planner app, which is something, so I always have to log in at the beginning of a session, and log out at the end, and always put a handover note on the app. So that's our, very regular way of staying in touch with the rest of the team. There is, for each support worker placement, there's a placement coordinator, and I keep in touch with her regularly whenever I need to check in about anything. So that can be by email or by phone. As I've said, we can call the office anytime if I'm unsure about anything at all. And I was actually told this at my induction. Basically, as soon as I've told someone in the office about anything that I'm unsure about, that shifts the responsibility for it from me to them. And that really allows me to feel supported, and take that burden, shift that burden away from me, so that I can concentrate on the job at hand. And yeah, 6 monthly support sessions, supervision sessions, the other way of linking in with the team, and occasionally just calling in at the office, just call in and have a chat, so that you're not feeling that you're just, because support workers, you're very often a lone worker, you feel that you've got that support there and other people on the team with you. In terms of the client's kind of wider support network, I would say I'm the liaison between the foster carer and the school. So keeping the school informed about other things that are going on in the boy's life that might affect how he behaves at school, and relaying information back from the school to the foster carer. And that's kind of me.
Yes, it is. It is. And very lovely. You were a solicitor, then you're now a support worker.
Yes.
Wonderful. Wonderful. There are a lot of things I picked from it, that, the flexibility, career is not from stage to stage, it's not linear. You decide what it is you want to do, the next step. So fantastic. Thank you very much. One question for you though. What is the name of your organization? Because you have spoken so well about the support that they give you. We want to know.
They're called Special People.
Oh, good. You see, Special People. Okay,
Special
that's
People,
nice.
yeah.
And where are they based?
They're based North London in Crouch End. But the organisation, we take referrals actually currently from 14 of the London boroughs. So my client is actually in Southwark, but the local authority responsible for him is Kensington and Chelsea, because he's been placed out of the borough. But we also have clients in Twickenham. We take lots from Hackney, and Camden, and Islington.
Yeah. There. Thank you for that. Thank you for that. Thank you.
You're welcome.
Does anyone have any questions for our guest speakers who have shared, the amazing job that they do in their respective organization? As you can see from, their talk, they love what they do. They love what they do. So yeah. If any questions, do you see any questions in the chat, Aruj?
No, no questions. But what I'd like to say or ask our lovely speakers is if you're okay for us to share your email with the attendees, if they do think of anything after the session, would they be okay to contact you? I think everyone is nodding. Perfect. Thank you so much. I think that is almost the end, but before we let you go, we just have a couple of poll questions. So before this
feedback.
Yeah, Maman, if you could put the Zoom poll back up. We're having a few tech issues. It wouldn't be normal if we didn't. If I could ask you to just scroll down, so please ignore question 1 and 2. And if you could answer question 3, which is after the session today, would you consider applying for a job in health and social care? So a nice, simple yes, no, or unsure. Do you think any of our lovely speakers have convinced you to think about health and social care? Perhaps look at roles in your area, look at that work-life balance. We've got 2 people that have answered yes, which is great. So far 100%. We'll give it a few more seconds. If we could have a couple more answers there. And please be honest, we can't see your names, so answer as you see fit. So far 5 people, so that's great. So positive feedback, thank you. And if I could just ask you to scroll down a little bit further, which is the last question number 4, which is what was the most useful part of the session? There's a couple of multiple choice answers: working in Southwest London, the social care, voluntary and community sector, the roles, of course, the roles, because our speakers are always the stars of our show.
Yes.
Finding work, places to look, volunteering, amazing. The guest speakers, unsure, or everything. So some people, half of you have actually said everything, which is great to hear. Thank you.
Yeah.
What I'll do is I'll just take the poll off, and I think we've had a question in the chat, Rachel.
Let me check.
It says, hi, I would like to know if anyone could advise me with my future, as I am a qualified counsellor therapist, a BA, which I could gain meaningful endeavours. So could any of our speakers perhaps answer that question? What is it? What if you want to unmute yourself and tell us what it is that what kind of role you're trying to get into, perhaps that could guide us in the answer that we could give you.
Exactly.
Okay.
Barrister Patrick, are you there?
Perhaps what we'll do is we will share a email after the session. You can liaise with us directly on that.
I could take it
I'll just pass you back to Rachel to wrap up the session.
Okay, thank you very much, Arisen. Thank you once again to our guest speakers and everyone who has spoken today. And thank you also to all of you that have attended and are still on. Like every other thing, we would like to have feedback from you regarding today's session to find, to look for ways to improve it. So I would say, please take time to scan the QR code with your phone camera and fill the form. Otherwise, you could, once we send the slides to you, please fill out use the link to fill out the form.
Oh, glory to God.
Can you do that?
Yes, sorry.
Have you added that? Oh, fantastic.
I'm so sorry.
Yeah, no, that's fine.
I feel like a total spaceman. Sorry.
Oh, no, that's fine.
My name is Patrick. I'm a resident in West Croydon. I trained as a counselor therapist a number of years ago.
Okay.
but due to unforeseen circumstances, I've been unable to link in with meaningful encounters other than bits and pieces of voluntary work, which you have been advocating at the beginning of your talk. And I would truly love to know if there is some key other than to register with the BACP, which I've been told umpteen times. I've actually done it, and my registration has ran out 3 times. I'm kind of saying to myself, that's not something I'm going to be backing again, because you have a registration, so there's there's a length of time that registration lasts. So after all, you have to keep renewing it, like.
Okay. Linda has offered to connect with you afterwards and to provide and to guide you with that. So thank you very much, Linda. We would exchange contacts so that you assist him in finding out. And I know how you do it. Just hello and how can I help, and ask questions. So yes, thank you very much for that, Linda. And thank you for finally, doing the tech stuff to come up and speak, Patrick. Thank you. Outside of that, I think Arush has put the link to the feedback form in the chat. If you click on it, please.
Yes, I have. Thank you so much. So it will only take you a couple of minutes. Do it now, do it later, do it after breakfast tomorrow, but it would just help us with our reporting and our project and improving these sessions further for those of you that live in the community. Yeah. Rachel, if I could just move you on to the final slide.
Before we do that, if you do want certificate from attending this, you would have to have completed you would have to complete the survey for us to be able to send that to you. So please be mindful of that.
Yeah,
and I'll move you to that.
Thank you. And the final slide, thank you. So it's just a thank you to all of those that have been involved. There's a lot of work that goes, time and effort that goes into organizing a session like this. So we really, really appreciate you joining us today. There is an email there, which is info@arcclimited.com. If you do have any questions or queries, please let them know. What we will do is we will send the slide deck to ARCC and they will forward it on to you. But again, like I said, if you have any questions or queries, please do not hesitate to contact them and they will contact us accordingly. Thank you so much for joining the session. We hope that it's been useful to you. We have a number of sessions in quick succession every Wednesday and Thursday for the next coming weeks. So if you do know of anyone who would like to join, please get them to sign up. But from me, that's a goodbye, and over to you, Rachel.
Yeah, for me also. Thank you for staying on, and thank you for our tech guy.
Yeah, thank you so much, Maman.
Thank you. Yeah, I wish all of you a lovely evening. And yeah, tell people, let them come join the next session as well, so they learn more about the health and social care sector. Have a lovely evening, everyone.
Bye.